Waging a war on drugs is, I mean, you're essentially waging a war on the people themselves.
Yeah, that was the beginning of my rock bottom. That was the beginning of the bitter end, I would say.
The addiction did not differentiate between a Muslim and a non-Muslim. So why can now the recovery differentiate, you know?
The unique geographic location, very close to the Golden Crescent or drug belt, provides an interesting background for examining whether the global challenge of substance abuse has encroached on this region.
I started using drugs in high school. I was 16 years old at this time. I came from a middle class family. I started using drugs with my friends. It seemed to be social thing in the beginning, some social. I could control it for some time. What I learned here, or what I realized here, especially in NA, that it's a disease, addiction is a disease. And I had this disease even long before the first time I used drugs.
The results from this year's Arab Youth Survey found that 57% believe drugs are easy to obtain in their home country, with the data ranging from 70% in the Levant countries to 32% in the GCC.
في الأول ما كنتش عارفة إن أنا عندي مشكلة مع المخدرات، كنت شايفة إن الحياة من حواليا بتبوظ أو بتنهار. بعد كده ابتديت أدور على حلول. قبل ما أدور على الحل بتاع ال NA ابتديت أدور على حلول إزاي أبطل مخدرات، عشان كنت تقريباً حاسة إن المخدرات هي المشكلة.
I believe I got addicted by the very first time I tried my drug of choice. I was 18 by then. I was in Germany, and it was just something that I fell in love with immediately, with the feeling that it provided me, something that was missing in my life to that time. And yeah, it was just, I was crazy about it.
Everything went out of control. I lost jobs. I was married at some moment of my life. I divorced my wife. My family relationships just went. I couldn't maintain good family relationships.
حاولت أغير الناس اللي بقعد معاهم، حاولت أغير نوع المخدر اللي بضربه.
There was something that happened that was part of my rock bottom. So that was actually that I lost all my money, my businesses, and my cars, and my money, and. Yeah, that was the beginning of my rock bottom. That was the beginning of the bitter end, I would say.
The term substance abuse and drug abuse have been recently replaced by the term substance use disorder, which refers to the use of one or more substances that lead to a clinically significant impairment. And this new nomenclature is extremely significant, especially in this region.
One of the issues that we have in the region, in the Middle East and North Africa, when it comes to drugs, is we believe in very strict laws. We believe in the criminal justice system and punishment as a way of managing, let's say, or minimizing the rampant increase we're currently facing in the Middle East, when actually, if there's anything that we've learned from the rest of the world, is that's not the correct approach. Waging a war on drugs is, I mean, you're essentially waging a war on the people themselves. If there's anything that we've learned, is a softer approach, a more sympathetic approach towards the people and the reasons why these people are turning for substance abuse is a much more effective approach.
So basically, those who have the disorder may be liable for persecution or could be labeled sick. In Oman, for example, the law explicitly states that drug addicts should seek medical help, but those who are peddling are liable for arrests and incarceration.
Drugs have always been an issue in the Middle East. It's become more rampant in more recent years. There's a lot of factors that play a part in this. Drugs have been more accessible because of rivalry, geopolitics. There's also been a lot more corruption in the region, but there's a multitude of reasons that have contributed to the rise of drugs in the region. But it's also becoming a major issue in the region because we don't have the narratives and we don't have the correct information and we don't respond to it in the correct way.
It is also worth noting that certain substances are more available in some regions. Due to geography and ethnicity, khat is widely used in Jazan regions of Saudi and Yemen. Children and low-wage workers in the UAE are smoking dried, crushed samsam ants to get a high.
أنا كنت فاقدة الأمل، كنت يائسة، ما كنتش عارفة أعيش، مش لاقية أي متعة في الحياة، مش عارفة أنا عايشة ليه أو رسالتي في الحياة إيه أو بعمل إيه.
My life was just, getting how to use and how to get more from the drugs. This is, it was obvious to anyone. My life was devastated, and he was the last one to realize it or to admit it. And the addiction did not differentiate between a Muslim and a non-Muslim. So why can now the recovery differentiate?
The baddest thing about addiction is that you don't see. You never see what's going on and how you're dealing with people, how you're treating other people, how you're treating yourself. And it is difficult to tell an addict something. It is very difficult because during my active addicted days, I wouldn't have listened to anyone. I pray for them. I pray for them to find the path because it definitely works. I just hope that everyone gets his chance to recover because it's the best thing that you can ever do.
However, it is not all doom and gloom for the ones who have been caught in the claws of addiction. An increasing number of drug addicts are learning to live a clean life through the addiction support group Narcotics Anonymous. The non-profit fellowship helps members achieve and maintain social sobriety through guidance, sponsorship, and encouragement.
Narcotics Anonymous, as is described in our literature, the society is a non-profit organization. Men and women gather together, having common problem of using drugs. We are meeting regularly to help each other stay clean. We're not affiliated with any other organizations. No tuition fees or dues, no pledges to sign, no promises to make to anyone.
ما بقيتش حاسة إن أنا مرفوضة زي ما كان عندي أحاسيس زمان. بقيت أقدر أتكلم، بقيت أقدر أعبر عن نفسي، بقيت فاهمة المشاعر اللي جوه دي بتتحرك ليه، بقيت عرفت أنا كنت بضرب ليه، اعترفت إن أنا عندي مشكلة مع المخدرات ومش هقدر أكمل معاها يعني.
The Cabin Group has operated in Chiang Mai, northern Thailand since 2010, treating clients from the Middle East and North Africa. Up to 6 people at a time can achieve treatment through the 8-week program at a cost of $30,000 per person. They recently launched the Salam program, a privately funded, tailored specialty program for those aged 18 and over, which integrates traditions and values of the MENA region with the potential to treat up to 15 clients.
The Cabin is a rehab facility that's based in Thailand, and Salam is specifically a program designed for MENA clients, so that's Middle Eastern and North African clients. And we're part of the Cabin in Thailand. And basically, this is a program that's specifically designed to reach this demographic in the world that's often been forgotten or for various reasons haven't had access to appropriate therapeutic services as far as their addictions are concerned. The treatment model of the Salam program is basically we look after the client's emotional, physical, psychological, and spiritual needs through very intensive therapeutic work. And we also involve a lot of psychoeducation around what it means to be an addict. And this education isn't specific to the client themselves, but to the client's entire family.
I started listening to what people saying, attending meetings, and my life dramatically improved since this moment.
I think the best thing is that life just became normal. Normal life. It's boring sometimes because we always search for the action, but it's good like this. It's healthy.